Okay, let's get started. Welcome. We're here to meet with Ella to discuss her progress since her hospitalization, provide updates on her condition, and make any necessary updates to her care plan. To briefly review, Ella, your hospitalization was due to a CVA, a stroke which led you to being unable to gain nutrition through normal eating, and the insertion of a PEG tube. There is also some residual impairment in thinking and ability to process information quickly, as well as a loss in your ability to get around independently as you were before. From our last meeting, we know you want to get back to your normal routine and community activities as soon as possible. Very importantly, you want to be able to return to enjoying normal meals as soon as possible. Is this correct? And is there anything you want to add?
That's about it.
Let's go around the room and provide updates. Rehab, can you go first?
Yeah, Ella was still very engaged while in the hospital. She was participating in speech therapy to get a jump on getting back to eating a normal diet. We have the hospital notes, and speech has picked up where they left off. Swallowing studies are taking place this week and will inform of next steps. The hospital speech therapist also noted some issues with cognition, so we are working on bringing her back to baseline there as well. PT and OT have been engaged to work with Ella. Physical therapy reports that Ella is participating in all sessions 5 days per week and is showing improvement in functional mobility, transfers, muscle strength, balance, and ambulation distance. She continues to require modified assistance for these activities, but it is improvement from the max assistance she required at the start of treatment. We are optimistic that she will reach her goals of walking in the courtyard, and occupational therapy has been working with Ella on grooming and getting her back to baseline with her ADLs. She's progressing well. Ella, do you agree? Do you feel like you're making progress?
Yes, it is slow, but I know I have to focus on being safe and not trying to push to get back to normal too fast.
I also agree with that from a dietary perspective. It has been great to have Ella back, and she is interested as ever in her nutrition. Ella, the speech therapist, and I have been working on a careful and thoughtful plan to wean her off the PEG tube and start introducing food again in a cautious and measured way. We have talked about the risk of moving too quickly, and Ella has been doing great so far.
Okay, thank you, therapy, dietary, and Ella. As a result of the hospitalization, Ella has required some follow-up visits with her neurologist, GI doctor, and swallowing studies. How is the scheduling of these appointments working out, and is transportation secured?
Yes, I have been able to schedule all of her follow-up visits with the physician and non-emergency transportation. We also have a backup plan in place if we encounter difficulties with the transportation vendor through some direct contracts with local vendors. Ella and I have also had the opportunity to catch up and talk about how she's been doing emotionally since her stroke. Obviously, this would be a difficult time for anyone, but Ella is determined. She has had some tough days, but overall her mood has been positive. And on those days when it is tougher, we've created a goal of reaching out and engaging in activities and social interaction.
I can speak to that. Before her CVA, Ella was one of our most engaged residents. It's occasionally been a little bit more difficult to have her participate in our activities, but we're working together to keep that moving forward. How do you feel about your engagement, Ella?
Well, it's tougher now than it was before. I don't feel as sharp as I was, and sometimes I feel embarrassed when I should know the answer or be quicker to notice I have bingo like I used to. I feel like I need more help, and that has never been easy for me to accept. Getting out and continuing to do things even when I feel uneasy has been helpful, though.
Pharmacy, what have your observations been? Could the cognition issues be medication related?
Possibly. When Ella came back from the hospital, there was a new medication interaction that we had to deal with between her digoxin and sitagliptin. The sitagliptin was a new medication that was started for her diabetes when she was in the hospital. Although the drug interaction is uncommon, sitagliptin may increase the DIG blood levels and cause cognitive impairment. She's currently taking 0.25 milligrams once a day, and this dose is actually on the Beers high-risk medication in the elderly list, and it may be a good idea to do a DIG level.
Lastly, Karen, as Ella's nursing assistant, you are interacting with her throughout the day. How is Ella doing? In your observation, are we missing anything?
No, not really. She's very determined and wants to be able to do as much as possible for herself. I have been keeping a close eye on her skin as well. After not being as mobile in the hospital, I've noticed some red areas and reported them to the nurse for assessment. We do need to be very careful with that and risk of fall since she's on a blood thinner now. Other than that, I'm just glad she's back.
Ella, does this plan seem like it is on the right track for you? Is there anything we are missing that you would like to add?
Just make sure the first meal I get to have includes that peach cobbler they make. I am missing the best part of the season.